In some immunoassays, it is not the antigen which is labeled, but rather the antibody. In this example, antigens are attached to the sides of a tube and they are combined with labeled radioactive antibodies. When these antibodies are the only antibodies present, they will bind maximally, and after unbound antibodies are removed, one would obtain the maximal reading from the radioactive antibodies bound to the antigen. If, however, antibodies from a second source, say from a patient's plasma, are added, then they compete with the labeled antibodies, and thus fewer labeled antibodies will be able to bind the antigen, more will be washed away, and the reading will decrease. And so not only could this test demonstrate the presence of antibodies in a patient's blood, but also the relative amount, because the more antibodies which bind a specific antigen in the patient's plasma, the less of the radioactive label, which are also antibodies, will be able to bind the antigen, and then the lower the subsequent reading of radioactivity.